I'm coming because I had a lot of pain in my body, and especially in my foot. This foot, this ankle, this here, this pointing, and my knee, and just little this knee, and I had to problem in my urine, in the pee-pee. He do surgery for 9 years ago for the urine, for the pee-pee, and he another surgery is 3 years ago. He take care of my utero because I had a heavy period, and the heavy period I had anemia, and this is what he doctor say I take care of my utero.
Gotcha. Okay, so to clarify to the viewers, okay, so what she's talking about is that she has incontinence, bladder incontinence, okay, and had the surgery 9 years ago, still didn't resolve it. And the other component is also with a heavy menstruation, and just won't ease up with the menses. So as a result, with the continual blood loss, that's why she resulted in anemia. And they did a hysterectomy to remove her uterus. Okay. So I understand you're talking about pain in both knees, okay, left ankle, and the right heel. But more importantly, you told me about there's been something going on with your uterus. It just wouldn't stop bleeding out. Well, it's not a problem anymore because the surgeons took it out. Right? However, this is still a problem. Okay, you say that even though you drink a little bit or shortly afterwards, you just void, meaning you just go pretty shortly afterwards, correct? So here's the deal, okay? The areas of spine that we're looking for where potential nerve dysfunction is this region right over here. Okay? If there is a structural abnormality in that particular area resulting in nerve dysfunction, see how it's all connected from here? Can impact your uterus and the bladder. This same region of nerves, okay, they're also responsible for providing nerve function to your knees and to your ankle and feet. All right. So while yes, I understand you had these pains and these problems over here, I want to take a closer look right at the source, what caused all this domino effect. Get you better from there. This is what normal is supposed to look like. It's supposed to be nice and straight. I think you and I could both agree that doesn't look straight at all, right? So what caused all this domino effect over here? Okay. So what I identified, okay, is this one structure right over here. This one right over here. It's just this one, the fifth lumbar. Okay. So this one over here, as we pointed out before in the other chart as well, okay, because this fella shifted out of alignment, okay, it's irritating the nerves that's leading to potentially the bladder, the uterus, the knees, and the ankle and feet. Okay, so this is the one we need to correct on you. So this right over here, this is the right foot. Okay. Ideally, what I want to see is over here, nice and level and straight. But we see these two, they're sticking out. All right. So what that tells me is these two bones over here, what they did was it went upwards. All right. So this talus over here, we need to correct this one. Even though you may feel pain here, I understand that because the joint space is open over here. Okay, as though it's a little swollen. But this is actually the problem right over here, this talus bone. With this left foot over here, okay. Again, once more again, I don't want to see anything protruding beyond here. However, what I see is these two spots over here. So what's going on with this talus over here? See this sharp protruding part over here? Okay. That right over there is heavily degenerated. Okay, we're talking about a serious damage right over here for a very long time. Okay, this is not recent, a very long time. Okay, so from what I could tell already, this is the one we need to correct on you. In addition to, here's an interesting tidbit: you got a heel spur right over here. That's what this is over here. So, how does the heel spur form? Well, we have a long fibrous tendinous tissue called plantar fascia. Okay. So it has a lot of connections to to the front of the foot, okay, and all to the back. However, when the arch starts collapsing, okay, we're talking about the medial arch or inside arch due to this collapsing. Because when this collapses, everything else collapses. That's why you had that flat foot. Now, here's the deal, okay? When you have a flat foot, give it a moment here. Just like over here, normal supposed to have a nice arch like this, okay? Now, because the feet start to collapse like this, okay, there is still tissue connected here, from here to here, okay? Now, because when it starts to get flatter, okay, it stretches out the tissue, okay? It starts stretching out the plantar fascia. Now, at this particular ankle point, right over here, okay, that's what the plantar fascia attaches to, okay? What happens is, when it starts to tug and pull so much to the point that it's almost ripping off the bone, okay, the body says, hey, wait a second, it's pulling way too much. We got to prevent this. So, what's the most strongest material in the body? Bone, right? So what the body will start doing is, because it becomes inflamed, okay, it starts depositing calcium. So it's a two-way, it's it's a two-way benefit over here, okay? Calcium will help reduce the inflammation, in addition to convert a part of that tendon into bone. So that's why during that 2 weeks, okay, you may feel pain. And then another 2 weeks says, hey, whoa, this feels good. And then another 2 weeks, it keeps on cycling. Keep on going, right?
Yeah.
Why is that? Because, again, because the ankle point now turns into bone, okay, that tendon part. Okay, it takes a lot of strain off of that. You feel relief. Problem is, it's still flat, and you're walking on this, okay? So because you're constantly aggravating and pulling like this, okay, and keep on tugging on this, now that even that new ankle point starts to get irritated, okay? And the body recognizes, oh, hey, wait a second, this is starting to rip again, okay? Fellows, still not resolved, okay? The arch is still not resolved, still not restored, okay? Let's deposit even more calcium, convert that into more in the bone, and what happens? It's a vicious cycle. Keeps on repeating, okay, until the anchor point becomes strong enough. That's what the heel spur is. Okay. That's how it forms.
Yeah.
Right? So what's the real solution? The real solution is we got to restore that medial arch. So instead of feeling a flat foot over here, we got to restore the arch like this. Okay. And that's going to be an interesting challenge because that's heavily degenerated. Okay.
Yeah.
So we're going to do our best to try to restore this function in here as much as possible. This is your right knee, okay? What I want to see is like this, okay? Even spaces.
Yeah.
This one is narrow. This is wider.
Yeah.
Okay? So that explains, okay, that right knee is a problem. Now, here's another thing you should look at. See the space over here?
Yeah.
Okay? Narrow here, wide here.
Yeah.
Okay? So that tells us, okay, the way it's misaligned, this bottom part of your leg, okay? We're talking right beneath the kneecap. This thing's misaligned. So, meaning it actually went this way.
Yeah.
Okay. So this is the one we need to correct on you.
Okay.
Okay, so we can see already right over here, this band of swelling right over here, and that's right at that fifth lumbar. Okay. So when we take a closer look. Fifth lumbar is right there. Okay. Tender? Pain?
Yeah.
Okay. You can feel that it's also stuck in that position too. See right there? It's not moving whatsoever. Yep. That's where we're going to fix it. Let it go. Right there. There's a piece already. Walk around a bit.
Oh my God.
Okay. What's different?
Yeah, it's different.
Oh, what is different?
Oh my God, I'm feeling more stretch, more, stretch. Yeah, and I don't know how to explain, but I'm feeling different.
Okay, that's good.
Yeah.
So because there is significant degeneration, and the damage is quite severe. The pump itself for quite some time before it takes the correction itself. How's it now?
I'm feeling different.
Okay, what is different?
I put before I'm feeling to my my toe is little, I don't know, press. I don't know. Now no. Now no, it's different. Yeah. Before, so pointing there, press. But now it's I'm feeling it less.
Less.
Yes.
See, feel this? Stable. Over here, it's loose.
Okay.
Okay?
Okay.
So, see that? Not moving. That way. This way, it moves fine. This way, stuck. Okay? So we already identified this is the one we need to correct on. Okay?
Okay.
So, same as before. Yeah, I know. No, we're gonna pump this up, okay, and then we're gonna set this bone right over here.
Oh!
Okay. Breathe.
Oh my God.
Put it up. I know, because it's badly misaligned. Okay. Go ahead. Try bending that knee. Bending. Yeah. How's it feel?
Different. Good.
Yeah.
No, I don't feeling now, because when I do here, I say all the time, or say but now it's okay.
Well, how do you like that, huh?
Good.
Yeah.
Very good, doctor.
Oh, you're welcome.
Yeah. Thank you.
Oh, you're very welcome.
Oh wow. Yes, doctor. Very good.
That knee needs some time to heal up. Continue icing it, okay, 3 times a day for 20 minutes.
Okay.
And we'll follow up on the next visit to see how you're doing.
Okay.
All right.
Sure.
Okay. Any other questions?
No, maybe next time I make more questions.
You got it. Okay.
But now I'm feeling good.
Okay. We're all set.
Yeah.
All done.
Thank you so much.
You're welcome.
Okay.
Oh, okay.
Thank you, doctor.
You're welcome.
Okay. I'm feeling so different in the first time you coming with you. Oh, I'm feeling better. That my pain is less. Less.
Good.
Yes. Doctor, I think so. I think it's more better.
Okay.
More better because before, you know, this is the problem with the pee, and before I drink a lot water and I need to bathroom in 20 minutes. Now it's little long, and I retain more.
Good.
The control PP.
Yeah, I believe you mentioned that now it's like you could do it every, not 1 hour you could hold it after you drink?
I think so.
Yeah, about an hour, right?
Almost in 1 hour.
So that's a big difference where you mentioned before. It's just like, what was it, like 5-10 minutes and now it's just 1 hour? Okay.
Yeah.
Right?
I think so, it's fine. And you know why? And I drink it, I think now I drink a little more water than before.
Good.
Because I don't drink soda, juice, just water.
All right.
But always I drink just water. But now I drink little more water because my body, she needs a lot. It need a lot of water.
All right.
Yeah.
Well, thank you for the updates.